Welcome to Aging Gracefully on Suncoast FYI. I'm your host, Nancy O'Neill. Each week I speak with local professionals on a wide range of topics, from fitness to finances and from dance to dentistry. We are here to give you tips and advice on how you can live a happy and healthier life no matter what age you may be. Smile Sarasota is downtown Sarasota's dentist, serving Sarasota, Longboat Key, the Rosemary District, Gillespie Park, and St. Armand's Circle. One of Smile Sarasota's many dental services include preventive dentistry, which is our first topic of today. Let's see what Dr. Adam Still has to say about preventive dentistry. Welcome to the program, Doctor.
Hi, Nancy. Thank you for having me.
It's so good to have you here, and I've seen you many times, and it's nice to have you sitting on the other chair today.
All right.
So you're going to tell our viewers what it is that you do to help them keep their teeth healthy, preventive dentistry, right? So what's that all about?
Well, preventative dentistry is something you can think of as measures that dental professionals take to prevent the development or progression of oral health disease. Really, the key is, you want to catch something early so you can take care of it before it progresses into something far more difficult to treat and therefore usually more expensive to treat. We often have the joke in our office that dentistry isn't anywhere near as expensive as negligence is. So it's something you want to take care of early and not let it go until you finally have a major issue going on.
Yeah, well, there was something that I saw years ago, and it still makes me smile. It's only floss the ones you want to keep.
True, yes.
Okay,
another joke we have, yes.
Yeah, so it's that. So what preventative measures can we as individuals take?
Well, I think from the patient's perspective, it really boils down to home care. It's making sure you're brushing and flossing with the proper, technique, the proper duration, and also making sure that, you're being productive when you're doing it. You're not doing it the wrong way. You're making sure you're getting all the bacteria out of there, because that's really the key to all of this, is to make sure you're removing the bacteria before you let the disease process take hold of either your teeth or your gums.
Mm-hmm. Okay, so when you're saying brushing properly, what is actually brushing properly, and how long?
Well, the key is like a 2-minute toothbrush, and I really recommend electric toothbrushes for the most part, because it's got a nice timer usually on them that lets you know how long 2 minutes is. We tend to brush for about 30 seconds and think we're done, but it's nice to actually have that running clock there to let you know. Also making sure you're flossing in a way that you're reaching all the surfaces between the teeth that you possibly need to. Okay. So just doing it isn't usually good enough. You got to make sure you're doing it correctly. And it's good to have a dentist or a dental hygienist, advise you as to how to go about that.
Okay, and just from a personal point of view, I started using an electric toothbrush now, I would say 3 years ago, and my overall dental health has improved.
Absolutely.
So it really does make a difference instead of just doing this. That rotates or vibrates at so many RPMs per minute. It's just, it's getting 5 minutes in for 2, really.
Yes, they do a great job, absolutely.
When you do that. So the issues, what do you typically see when somebody comes into you that needs treatment?
Well, there are quite a few things that I see. I think probably the most obvious thing would be tooth decay. When a tooth starts to decay, the very first part of that process is that the minerals are being pulled out of the outer surface of the tooth, or the enamel. When the minerals come out, that leaves room for the bacteria to take over and start actually eating into the tooth. But if we catch it in that early phase where it's just demineralizing, if we add minerals back into the tooth, we can kind of reverse the process. Now, if we don't catch it that fast and it starts to eat into the tooth, the next step would be to actually do like a filling on the tooth, for example. So you'd remove the decay, fill the cavity, and then we should be done with it. But in a case where it's more extreme is where the decay is eaten further into the tooth, where the center of the nerve is and the blood supply and all that. And at that point, now the tooth's become infected. Now it involves a root canal and then restorative work to go on top of that. Yeah. So you watch that progress from something very easy to fix to something far more difficult to fix. Mm-hmm. Another example that would be cracks, which is a similar process where you get a little stress fracture on the outside of the tooth, but if it's not caught early enough, it'll turn into a much deeper crack, and that deeper crack will eventually cause the tooth to fracture. Sometimes it just breaks a piece of the tooth off, and in other cases, it will actually crack all the way through the tooth. It may not even be salvageable at that point, or it may just crack again into the nerve canal, back to our similar situation as before, where now we're looking at a root canal and then more restorative treatment. So cracks are another big one, but I think maybe one of the real big ones is gum disease. Gum disease is a big one, and a tough thing about gum disease is you don't necessarily feel it as the patient.
Yeah.
You
Is
know?
that one of the things you see most often when somebody comes in?
Very,
or?
very common. We have people come in, and what happens with gum disease is bacteria will collect along the gum line. If it's not caught early enough, it'll get underneath the gums. Once it gets underneath the gums, it starts causing the tissue to detach off the root, and now we start losing bone at that point. Early on, if we catch it, it's just a matter of removing the bacteria before it's done any damage. But once it starts to eat the bone away, sometimes it involves surgical intervention. So another case where if we catch it early enough, easy to treat, more involved. Obviously, nobody wants to go down the surgical road unless they absolutely have to.
Okay. What's the most difficult thing about treating people preventatively?
You know, I think the hard part about preventative dentistry is that we're treating the patient again before they really are aware of the problems going on. And when you're doing that, you know, you're forced to educate someone. You have to go through the process, and sometimes taking pictures, demonstrating what's going on so that the patient can see the process developing, and then they can make an educated decision as to how they want to handle it. We're kind of talking about proactive dentistry versus reactive dentistry. With proactive dentistry, you know, we're heading things off before they get there, but with reactive dentistry, we're waiting until, you know, the tooth cracks or, you know, the patient's in pain. And, you know, frankly, that's kind of easier dentistry to do because when the patient can feel or see it themselves, they're coming to you saying, tell me what I can do about this.
Exactly.
But with preventative dentistry, you know, we're having to take that extra time to walk them through the process, which, you know, reactive dentistry may be easier, but you don't feel as good about it because you know you could have headed it off ahead of time.
Ahead of time.
Yeah.
Great. Well, thank you, and I hope our viewers get all of these tips and heed them.
Thank you very much.
Thank you. Coming up next, Dr. Jenny Wilkins joins us. We'll be right back.